So today we're going to cover an approach to managing neuropathic pain, which is something that you may come across quite commonly in general practice. Now, why we need a specific approach to it is that neuropathic pain doesn't typically respond to simple analgesia and needs specific medications that target the nervous system. So let's first define what we mean by neuropathic pain. Neuropathic pain is a positive sensory symptom that is characterized by pins and needles, tingling, burning, all quite uncomfortable, and can actually lead to significant distress and functional impairment in patients. So just to remember as well, neuropathic pain is just a symptom, and the underlying cause also needs to be identified and managed appropriately. Common causes for neuropathic pain that you may see are things like diabetes, alcohol, post-infectious like shingles, entrapment or trauma to nerves. It could be due to tertiary level neurological conditions like multiple sclerosis. It can also be due to deficiencies like B12, chemo, radiation, etc. So first try and find the underlying cause and manage it. And if you're not able to do that then you need symptomatic control. So the way we like to think about it is specific agents that suppress or target the nervous system. So two of the drugs that are most commonly used and are most effective is pregabalin or gabapentin. You often hear the trade name Lyrica being thrown around for pregabalin, or maybe Neurontin for gabapentin. And these agents work at the calcium channels, and it helps to modulate the release of things like glutamate. And this will help to suppress neuropathic pain. Unfortunately, often in state, or specifically for us, we actually don't have it on code. So we actually often will start off with what we have and end up writing private scripts for patients. But just to remember that these two agents should be your first line. Now let's talk about what we have available, or maybe with some cheaper options. So tricyclic antidepressants such as amitriptyline is a go-to drug for us, a drug that they take every night because of the side effects of drowsiness. Often start them at a low dose like 10 milligrams just to see if they're tolerating it, but that can be built up quite quickly to like 25, 50, and even higher doses if tolerating. So we just cover the side effects with patients like the drowsiness and the dry mouth, etc. Other agents that are on the antidepressant scale, such as the SNRIs like duloxetine or venlafaxine, can also be used. Then some of your anti-epileptic agents such as carbamazepine or Tegretol, lamotrigine, valproate can all be used to try and help with neuropathic pain. Always obviously try and optimize one drug before we go on to polypharmacy. So these cover all the oral agents. Other than oral agents for certain conditions, such as very localized pain, such as post-shingles, we can also consider topical agents. Topical agents like lignocaine patches or capsaicin cream can also be used. And then if we go to our special interventions, we can think of things like specific nerve blocks and some modulatory therapy. And then on top of all of this here, just also cover investigate for any psychological impact that this pain may be having. And like I said, it's a very unique kind of pain. So sometimes it has caused a lot of distress for patients. So just think that do they ever need more support, cognitive behavior therapy, etc., to help target their pain. So just in summary, neuropathic pain is a positive sensory symptom characterized with things like tingling, burning, pins and needles. Doesn't respond to just simple analgesia, needs specific agents. Try and investigate for the underlying cause and then use symptomatic treatment, whether it's our oral agents like first-line gabapentin or pregabalin, or some of our antidepressants like amitriptyline or venlafaxine, or some of the anti-epileptic agents. And then if you have available some of the other special things like topicals or other interventions. And obviously on top of this here, you can try simple analgesia, but make sure you are covering them with the other special medication.